Position the patient in a semi-Fowler's position. Place a towel or linen pad over the patient's chest. Don sterile gloves. Suctions the tracheostomy tube. Remove and discard the soiled tracheostomy dressing in the appropriate receptacle, and then remove and discard the gloves. Place the tracheostomy equipment on the overbed table and prepare the equipment using the sterile technique. Pour hydrogen peroxide into one of the sterile solution containers and pour normal saline solutions in the other one. Pour hydrogen peroxide into one of the sterile solutions containers and pour normal saline solution into the other one. Open 3 4x4 gauge packages. Wet the gauge in one package with hydrogen peroxide. Wet the gauge in another package with a normal saline solution, and keep the third package dry. Open 2 cotton tip applicator or packages. Wet the applicators in one package with normal saline solution, and wet the applicators in the other package with hydrogen peroxide. Don sterile gloves. Keep the glove on your dominant hand sterile. Handle the sterile supplies with the dominant hand only. Open the package containing new disposable inner cannula if available. Open the package of vector tracheostomy ties or cut-like twill tape long enough to go around the patient's neck 2 times. Make sure to cut the end of the tape on an angle. With your non-dominant hand, remove the oxygen source if the patient has been receiving supplement oxygen. Unlock and remove the inner cannula with your non-dominant hand and care for it accordingly. If disposable inner cannula was in place, dispose of the inner cannula in the biohazard receptacle according to agency policy. If a reusable inner cannula was used, place the inner cannula in the basin filled with hydrogen peroxide. We attach the oxygen source if indicated. Clean the stoma under the faceplate with a cotton tip applicator saturated with hydrogen peroxide using a circular motion from the stoma side outward. Use each applicator only once and then discard it. Clean the top surface of the faceplate and the skin around it with the gauge pad saturated with hydrogen peroxide. Use each gauge pad only once and then discard it. Repeat 13 to 14 using the cotton tip applicators and gauge pad saturated with normal saline solution. Lastly, dry the skin and outer cannula surfaces by patting them light with the remaining of dried gauge pad. For that, seek assistance from another staff to help with changing the tracheostomy stabilizers. On this part, We'll be using the twill tape, threading one end of the twill tape into one of the eyelets of the tracheostomy faceplate. For that, insert a pre-cut sterile tracheostomy dressing under the faceplate and new tracheostomy stabilizers are folded a 4x4 gauge into a V shape. Lastly, dispose of the used equipment in the appropriate biohazard receptacle according to the agency policy and tidy the area. Remove the soiled tracheostomy stabilizers. Removing the soiled bellow tracheostomy holder with assistance stabilizing the tracheostomy tube, disengage the Velcro on both sides of the soiled holder. Remove it gently from the eyes of the faceplate. Discard the Velcro holder in the nearest biohazard receptacle. Removing a soiled twill tape tracheostomy ties with assistance stabilizing the tracheostomy ties using bandages. Users avoid cutting the tube of the tracheostomy balloon. Remove the ties gently from the eyes of the faceplate and discard them in the nearest biohazard receptacle. So have the patient flex his knees and apply a new tracheostomy stabilizers. Using a Velcro tracheostomy holder, unfasten the Velcro, thread one end of the tracheostomy holder through the eyelet of faceplates, and fasten the Velcro. Bring the holder around the back of the patient's neck, thread the remaining end of the tracheostomy holder through the empty eyelet of the faceplate and fasten the Velcro, making sure that the holder fits securely. Place one finger under the holder to make sure that the holder is securing the tracheostomy effectively but isn't too tight. Now for the evaluation, assess the area around the stomach site for signs of skin breakdown. Evaluate the patient's tolerance of the procedure. Note whether there were any signs of respiratory distress. And for the documentation, document the date and time that you performed the tracheostomy care. Note the color, amount, consistency, and the order of secretions. Note the conditions of the stoma and skin around the stoma site. Document respiratory status, including respiratory rate, the depth of pattern skin, color, and the breath sounds. Note the patient's tolerance of the procedure. And lastly, if problems arose, document any interventions that were necessary.